to modernize and revitalize SUNY Downstate Hospital. So we are very excited that you are joining us today. Some of you, I think, have been with us. This is the third hearing, so we're excited to have you back to hear from you. We want to make sure, I know there are people still coming in, but I would like to get us started because we're going to have a slightly different agenda today. We've heard from you, so we are going to discuss a few updates of what we have heard before we take testimonies from, if you have signed up for an oral testimony, we will call your name. If you would like to sign up to do to make a statement, we're going to ask if you can sign up at the front, at the desk, so that we can do that in an orderly fashion. But we are pretty excited of what we will be able to share with you this evening, and we are excited to hear from you. Before we get started, I also want to at least take this time. I have learned after 3 public hearings to say thank you at the beginning instead of thank you at the end. So I do want to thank the team and staff at SUNY Downstate University, the SUNY Downstate Hospital for being a wonderful partner in helping us coordinate this public hearing today. I want to thank my team. I'm Oma Holloway. I'm with Adina Consulting Group. I'm the founder and chief strategist, and my team has been very diligent over the last couple of months of helping support these public hearings. So I would like to thank them. Alicia Goodridge is here. Want to thank her and Jamie Greco for their support. Yes, I think I've covered most before I do my thank yous to the Downstate Community Advisory Board, who we will introduce, and thank them for their dedication and support. So I want to make sure I didn't forget anybody, but like I said, I know that when we end, everyone is ready to go. So I want to make sure these thank yous. And I want to thank all of you who took the time to come out, some of you to all 3 hearings, for signing up and registering, for writing, taking the time to write your testimonies. All of this is really driving the work that we are doing to make sure that we make best recommendations possible to support SUNY Downstate Hospital. So on that note, we know that this is religious observances. We also know this is a challenging time. But we also want to respect a hopeful time. So more than ever, would appreciate if Pastor Straker can come and lead us off in prayer.
Good evening, everyone. Good evening. Good to have you with us this evening. Thank you, Omar, and to my colleagues on the board. Good evening to each and every one of you. You know, I was just thinking on the way here and contemplating on the time and the season in which we live. I was thinking about even the religious season, that it is the time where our Jewish brothers and sisters, they commemorate the saving of the Jewish people at a time where they were set to be annihilated. And I was looking at a scripture, very familiar scripture in Esther chapter 4 and verse 14. And it says, "For if you remain silent at this time, relief and deliverance for the Jews will arise from another place, but you and your father's family will perish. And who knows but that you have come to your royal position for such a time as this." I thought this scripture to be apropos, especially in the time, in the space that we are here today, that many of you have lifted your voices because you did not want to see Downstate annihilated. And even in this time and season, there's a need for voices to be raised so that we can safeguard the lives of people, not just here in our communities, but in our nation and around the world. And so I pray blessings over this hearing tonight, that the words that will be spoken and seasoned with grace, seasoned with the love and the care and concern for our community. I pray that we will have ears to hear, and I pray that we will be able to communicate with one another. I pray that God's wisdom and guidance will be with each and every one of us this evening, and that we would leave here with a greater purpose, a greater understanding of what it needs or what is needed in order to better Downstate. May God's favor and blessing be upon us all. I pray this with respect to all faith traditions in the house, but I pray this in the name of my Lord and Savior, Jesus Christ. Amen.
Thank you, Pastor. Okay, I'm going to make this a little easier. Another lesson that I learned from one of the public hearings is get a very high chair. It helps. And so hopefully we can really, I want to really take to heart what Pastor said, because of your voice and we hear you, I want to start off this public hearing by saying, just so that we can celebrate some wins, is that SUNY Downstate Hospital is not closing. I mean, we can clap, we can keep clapping for that. It's like, you know, that is what we like to start off with. And as we move forward, as part of the legislative statute, there was a 9-member board appointed, and I am going to introduce them. These are very dedicated individuals. I've had the honor and pleasure of working with them over the past couple of months. We're being joined by 6 in person, and 3 are on the Zoom. I wonder if can we pull them up as just so that people can see who's on Zoom? I also want everyone to know that this is being recorded. So all the testimonies, we are being recorded. We have Angelo in the back and the team here at SUNY. We will be recording, and the full recording will be on a public website, which we will give you the QR code that you can pull up at any time to see the recording, which should be up on the site within the next couple of days. So we'll reiterate this a couple of times, but I do want to make sure that everyone is aware that this public hearing will be recorded. So with no further ado, I would like to introduce our Downstate Community Advisory Board. First, I would like to introduce Dr. Anitza George, who is the chair of the Department of Family and Community Medicine here at SUNY Downstate. On Zoom, we have Dr. Leslie Kernasant, AKA Dr. K, who is a healthcare leader and advocate. Dr. K.
Yes,
we have Chancellor. Oh, hi, Dr. K. We have Chancellor Dr. John King, is the Chancellor of the State University of New York. We have Dr. Fred Cowell, who is the President of the United University Professions Union. On Zoom, we have Dr. James McDonald, New York State Commissioner, the Commissioner, Dr. James McDonald, the New York State Commissioner of Health. There. We have Dr. Donald Moore, Physician and Advocate for Healthcare Workforce Development. Dr. Moore is on Zoom.
Good evening, fellow Brooklynites.
We have Andrew Rain. I said it right? Brian? I say, you know what, I'm going to get this right by the end. We have Andrew Wright, who is President of Citizens Budget Commission. We have Pastor Louis Straker, who is the founder and lead pastor of Reflections Church and 67th Clergy Council, right? Precinct Council. And we have Claire Patterson, who's retired COO of New York City's Health and Hospitals Community Care. Okay, so thank you. So before we get started, we want to, if we can move to, oh, I just want to make sure that we know who's all on Zoom. We do have Debbie Lewis from Governor Hochul's office, if she could introduce herself and say hello. Debbie, are you with us?
Yes, I am. Good evening, everyone. Glad to be with you and sending greetings from Governor Kathy Hochul.
All right, thank you. And we also have Alyssa DeRosa, yes, from New York State Health and Hospitals.
Hi, everybody. I'm the Associate Commissioner of Governmental and External Affairs for the New York State Department of Health.
Okay. So with that, we're going to give you a few updates. So before we get started, I will let you know that this will also be on the public website. This, okay. So, as most of you know, SUNY Downstate Hospital was constructed in 1966 and is certified by the Department of Health for 342-bed double occupancy. I'm going to stick as much as possible to the script that's on the screen for the sake of making sure that we have enough time at the end, but also that I'm not making any mistakes. So I want to make sure I am sticking to the script. SUNY Downstate Hospital is comprised of an 8-story wing and an attached 3-story section of building totaling 693,000 gross square feet, and as most of you can acknowledge, needs some major capital rehabilitative work. The Downstate Community Advisory Board's charge is, as we have introduced, the DCAB is a 9-member appointed board pursuant to legislation that was enacted last year. This advisory board is charged for the modernization and revitalization of SUNY Downstate. It shall complete a study and provide written recommendations to prioritize healthcare services in the SUNY Downstate area. Their recommendations must be reasonable, scalable, and fiscally responsible plan for the financial health, viability, and sustainability of SUNY Downstate. Originally, capital funding was not to exceed $750 million, with a report deadline of April 1, 2025. Thanks to Governor Hochul, now the full $750 million in capital funding will be available. And given the complexity of the situation and the desire for additional feedback, the report deadline has been extended to on or before June 1st, 2025. This is what we heard from you. So, you have been heard, and thank you. So some of the factors that the Downstate Community Advisory Board are considering: overall healthcare service delivery trends and models, historic and projected financials for the hospital and the campus. Current state of building infrastructure and capital needs. Oh, I'm sorry. All right, Lynette, you're gonna have to help me out here. 'Cause this is... All right, and thank you. Community healthcare needs, outcomes, and health disparities. Existing inpatient and outpatient service offering and health outcomes. Capacity and availability of inpatient and outpatient services in the broader primary and secondary service area. Efficiency of operations and quality of healthcare services benchmarking. Training needs for students and employment outcomes. So part of the DCAB role is the outreach to the community. As we said, we wanted to hear from you. We held our first public hearing here at SUNY in January. At that hearing, we had approximately 375 people in attendance. 56 individuals provided oral testimony. We had 12 elected officials present, and we had numerous written testimonies. The second hearing was held at Medgar Evers College. It was held in February. It was held in February, just a couple of weeks ago. And we had approximately 150 people. 25 people gave individual testimonies, and we had 11 elected officials present at that meeting. Also, the DCAB has spoken to many stakeholders or other professionals, and requests that were made to meet with the board and talk to them about some of their recommendations and ideas. We've met with SUNY Downstate President, the College of Medicine chairs, the interim CEO of the SUNY Downstate Hospital, Health and Hospitals, Kings County Hospital, Maimonides, One Brooklyn Health, and Brooklyn for Downstate. Just to illustrate kind of what some of the feedback has been, this is not an exhaustive list, but this just gives you an idea of some of the key themes and ideas or recommendations that came through written testimonies, oral testimonies at the public hearings. The written testimonies, this is a compilation. Like I said, this is not an exhaustive list, but it does give you a snapshot of what we've heard. Yeah, the second one. And your feedback also included some of the services that you would like to see enhanced at SUNY Downstate Hospital. Some of that included inpatient and ambulatory care, outpatient and emergency services have been emphasized. Community health needs have introduced several service lines into discussion with frequent references to oncology, maternal health, preventive health and primary care, chronic disease treatment, kidney transplant, cardiology, and many more. Some of the recommendations have been increasing case mix, electronic health records, EHR, and stronger collaboration and strategic partnerships with nearby hospitals were also areas of focus. This came from you. Key issues that the DCAB must consider or considering. What does the community need most that Downstate is best positioned to provide? What should be the mix of inpatient services, and what should be the mix of outpatient services? What is operationally, financially feasible? How much and what type of space is needed for the various inpatient and outpatient services? How should the available capital funding be invested? Working with the DCAB are a number of consultants who are providing support and information and data. That includes the Adena Consulting Group. We are helping with the outreach and the facilitation of these discussions. The Kaufman Hall, who are looking at marketing and financial analysis and data. Infrastructure, Ewing Cole, QPK, and Rambo. You have that? The feedback identified a number of strengths about SUNY Downstate Hospital. One, the hospital is valued. It provides important inpatient services and what has been said over and over again about the kidney transplants that are provided here at SUNY Downstate Hospital. Vital services are regional, perinatal care, and more. And it has the trust of the community that was overwhelming in the feedback. It trains diverse workforce. As you can see, large, high-quality medical school and health professions programs. The medical school classes are more diverse than the national average at 93rd percentile for African American graduates. Graduates tend to stay and work in the community. Concordant care improves health outcomes. It addresses health disparities. Work of the hospital and clinicians addresses health disparities. It ensures access as a safety net institution, and it's community-informed and action-oriented disparities and health equity research. However, we know there are challenges, and this was expressed by many of you and from the work that from the feedback that we're getting. The community health needs are vast. High rates of chronic conditions, maternal and infant mortality, cancer, and high ED utilization. Shortage of primary and preventive care contributes to avoidable hospitalizations. The trend is toward outpatient care, with outpatient services expected to grow 16% nationally over the next 10 years compared to a 2% projected growth in inpatient volume. SUNY Downstate Hospital underutilization. The average daily census is about 160 patients. About 1/3 of Brooklynites leave the borough for inpatient hospital care. SUNY Downstate accounts for 9% of inpatient volume in its primary service area. Only 1 in 10 hospital admissions are elective and not through the ED. Okay. Is that, now I definitely feel like okay, that was different. Okay. Hospital volume is correlated with better patient outcomes. Financial feasibility, huge challenge. The hospital has been running a deficit of around $80 million to $100 million without temporary state support. Government payers account for more than 80% of revenue. DISH helps significantly with Medicaid. Small standalone hospital needing referrals and economies of scale. Infrastructure is aging and needs investment. As we review inpatient and outpatient services, DCAB is exploring and analyzing a variety of options and service lines based on feedback from the community and advice of consultants. This is including provisions for urgent care, emergency care, level of emergency care, ambulatory care, and ambulatory surgery, and many other areas of potential specialty service line expansions based on community need. So this is an example and an illustration of some of the challenges that are faced and based on some of the recommendations that have already been placed out there. One, as you can see on the side, this is based on millions and billions of dollars. So, this is where I think the light is actually. So, if we were to just address hospital core, thank you. Okay, thanks. Hospital core baseline systems issues, this is the mechanical, electrical, plumbing, which we call MEP, systems only, with no program impact. The cost could be close to $250 million. If there was a partial current hospital inpatient and or outpatient rehab, the cost could be between $250 million to $837 million. Now, this is just an example. This is for a portion of the hospital being fully renovated. For full current hospital inpatient and outpatient rehab, could be approximately $837 million, which includes the MEP, the mechanical, electrical, and plumbing systems. So, and this would mean a fully renovated hospital with 220 beds, private rooms, current service line mix. To build a new ambulatory care surgical center could be approximately $680 million to $785 million, and up to over $900 million if you consider equipment costs. And this is with potentially 10 operating rooms and other outpatient specialty services. For building a new scaled-back ambulatory care surgery center, could be approximately $300 to $680 million, up to over $800 million when considering equipment costs. This could be something less than 10 operating rooms and fewer specialty services. Thank you, Annette. And building a completely new hospital, the cost can be way over $2 billion. And this is looking at a 250-bed private rooms expanded service lines. So as you can see, it's a lot of information and a lot that needs to be considered and discussed for making the ultimate recommendations. Many of these recommendations came from you. We hear you. So, as we go into public hearing number 3, I don't know, are we going to keep the spotlights on, or can we or is this what we have to do right now with the spotlights? Okay, we'll work with it. All right, we want to continue hearing from you. This is our 3rd public hearing, and we've changed the question just a little bit to reflect that we did give more information, and this was also something that we heard from you, to get an update on what has happened so far. What are the updates? What is the information? Who have we talked to? So the question for today that we would like you to address, it's still the same, that we want, what are your top priorities for allocating $750 million in state capital investments to modernize and improve SUNY Downstate Hospital? We will keep this question up, but we also are pleased to announce that the DCAB will host another public hearing, a 4th public hearing. The date is to be determined, and we will make sure that it gets out as soon as possible. We also have this slide deck is on the public site, and you will have an opportunity if you would like. You could do it today or any other time if you would like to do written testimonies, but we will keep you informed when the date is confirmed of the 4th public hearing. So, without further ado, I'm going to ask my assistant, Lynette. We're going to, if you have registered, We will ask you, we will call out your name. Well, I'm going to pass this on to Lynette first, because before we have those who have registered, we do have a few of our elected officials here to say a few words, but we will set the parameters for that. And let me just check again on who's on Zoom. Okay, so I'm going to pass it over to Lynette.
Just really quickly, sorry, everyone. The microphone is on your left-hand side of the stage. You have 2 minutes for your to say how you would like to see where the priorities are for where for funding to be spent, and just be mindful and respectful of the person in front of you and behind you. So 2 minutes, please and thank you. And address your comments to our advisory members.
Okay, and we do have the timer. Did we say that? Did we show the timer? Everybody remembers for 2 minutes? But we have a few people here with us today, so we will start off with, is the Assembly member? Is the Assembly member here? Monique Chandler? Oh, okay, all right. Do we have Fred Baptiste from Community Board 9? If you want to say.
Good evening, distinguished members of the advisory board. At this time, I would just like to share a letter that has been drafted and approved by Community Board 9, and we are having conversations with Community Boards 17 and 14 as well with respect to the advisory board. Some of the information shared this evening is new, so there are some elements that have been addressed, but we definitely wanted to make sure that we made the statement that we are sending to the governor's office, and we wanted to let the advisory board know as well. So the letter reads, Governor Hochul, Brooklyn Community Board 9, and other community boards are committed to strengthening our health and medical institutions and expanding access to quality health care within our districts. As New York City's only public academic medical center and one of the largest employers in the borough, SUNY Downstate Health Sciences University serves a population of 2.6 million residents for their healthcare and academic needs. SUNY Downstate comprises of the College of Medicine, School of Graduate Studies, College of Nursing, School of Professional Health Professions, and extensive research facilities. Notably, it houses the only kidney transplant center in Brooklyn. Any disruption to these services jeopardizes the health and safety of those who rely on them. Testimony and feedback from Downstate faculty and staff, elected officials, community leaders, activists, and the public highlight the urgent need for a plan that protects our medical, healthcare, and academic assets while improving the quality of care for residents. Now more than ever, we need a hospital and academic medical center that can meet the demands of the future. The advisory board, established under Executive Law 996, is tasked with exploring options to strengthen SUNY Downstate and ensure its long-term viability. Transparency and communication from the appointed Community Advisory Board to both community boards and the public are paramount. To fully understand Downstate's short-term and long-term financial viability and foster solution-oriented discussion, it is incumbent upon the governor's office to provide the CAB the following: additional public hearings to engage the community, a financial analysis for rehabilitating the current facility, a financial analysis for constructing a new facility, a comprehensive list of programs and services that are planned for termination, a plan to prevent staff reductions during the transformation process. As the CAB is an appointed body, it must begin to adhere to the open meetings law to ensure transparency and thorough public engagement. We will continue to work with all stakeholders involved to accurately inform constituents of the transformation plan and opportunities to comment. We ask that you take testimony shared by faculty, staff, patients, and the public be taken into consideration once the advisory board has announced its official recommendations for the transformation plan. So I thank the advisory board for all the work that has been done, but there is so much more to be done in terms of making sure that this information gets out. While we definitely understand and respect the hearings and the opportunity for the public, we still insist that more needs to be done in terms of getting the information out. We've said it on a number of occasions before. There are a number of things that we need to fully understand about how we got here, so that way we can truly give informed feedback in terms of how do we get out of here and make sure that Downstate is everything it needs to be and is truly that hospital of the future that Brooklyn deserves. Thank you.
Thank you. And if we can get
Recording
is
stopped.
that a letter that you would like to give us a copy now, or you're going to upload? Okay, thank you. And I hope we did put the QR code up there. We want to make sure that everyone knows that you can have access to a public site that we do put this information on. We will also have this hearing that's being recorded. We'll go up on the site. You can also get the recording for public hearing 1 and the recording for public hearing 2. The website. Yes. Yeah, okay. Is it possible we can turn off the lights? It's very distracting for us up here. Yeah, if you can just, if there's any way we can just do, yeah, it's a little bit, it's hard for us up here. If we can just turn it off and like maybe have more of the light in the audience. Yeah, it's a little. If we can just have the house lights, but the lights up there is, yes, thank you. We can, is it, yeah, no, let there be less light. We are. Okay, thank you. Okay, so now they're pointing it directly at me. Okay. And yes, thank you. This is great. Okay. Yes, the video might be a little dark, but that's okay. Because now I see spots. Oh, it's going to take me a minute. Okay. But thank you. Thank you, Mr. Baptiste. And we would like to acknowledge this representative here from Assemblymember Brian Cunningham's office. Is he here? Oh, way up there? Right. Okay, thank you for coming. Okay, and when the assembly member gets here, we will ask her to give us a few words. Okay, well, we're going to jump right to it. We want to hear more from you. If you have a written statement, you can upload it on our site, or you can just hand it to us, and we will make sure that the board gets it. Now, is that better with the light? We're all, I agree with you. Okay. Okay. Okay, Vengen Isaac. So what we're going to ask, if you can line up, this is the microphone. Please direct it to the DCAB members who are on Zoom and here in front of you. So we have Ahmad Joya.
She's not here tonight.
Okay. Do we have John Williams? Okay, if you can start, we have 2 minutes.
Sure.
Thank you.
Thank you.
Thank you.
Good evening. I'm Isaac Vingen, an MD PhD student and the Vice President of the Student University Council. I'm proud to say that I've been a dedicated student and scientist at SUNY Downstate for the better part of a decade. We met 3 weeks ago, and I told you the importance of the University Hospital and how the hospital itself and its faculty are important for our education. I gave the recommendation that this community advisory board should prioritize a university hospital at Downstate that remains physically connected to the education building. I stand by this recommendation and my conviction that an academic hospital center needs a central hospital to remain academic. With 18 days left until the original state deadline, why am I here again? I'm here to address the sparse communication from the community advisory board to this community behind me. How can our community advise this board with our recommendations without knowing what plans the board is considering ahead of time? Where is the proactive distribution of digestible information outlining how the state's money can and cannot be spent? In 2 minutes or less, what is the difference between an infrastructure cost, a capital investment, and an operations cost? I have attended all 3 town halls, and the single thread that ties together every one of the statements is that we need more hands. We need more hands in every department. We need more nurses, we need more PCAs, mechanics, doctors, social workers, scientists, the list goes on. But from what I've gleaned in my own digging, more hands is an operations cost that is not permissible with these funds. In addition to requesting greater transparency in these final weeks, I also recommend we invest a portion of the $750 million in the development of a downstate business plan, a business plan that will sustain the operational cost of an expanded workforce. Because if things continue in the way that they have been, we will have fewer and fewer hands burdened with more and more load. If you are the only voice we get in this whole process, then we need you to advocate for Downstate's sustainability on our behalf. Of course, a new hospital sounds nice, but without new, passionate Downstate employees, the caliber of education and the quality of the care we provide will continue to decline. Thank you.
Thank you. Thank you. Thank you.
I think it's time for me to go home. No joke. It's almost every single thing that I came up here to say. It was all eloquently presented. But you know, I'm concerned with the figures that you come up with up there. I don't know if that includes the cost for putting it together. I know what it costs you to, the millions of dollars that you put together for these consultants to come up with this, but you've seen the community's rendition of what we feel would be a good system. Is that right? Mm-hmm. Brooklyn for Downstate. And I think you agreed with it. I think we can fit all of what you presented there that is needed in this hospital into that. And all it costs is $1 billion, not 2 point whatever going on all of that. So please, let us come together with your plan and look at this so that we can put it in. But one of the things that I am concerned about, you know, I worked in the Amazon, and there was one man in the Amazon, there's a medical center up on the hill on the mountain, and the people keep going up there and getting sick, coming back down, going back up. And the guys up there says, you know, what's going on down there that's causing them to come back up all this time? So they decided to go down, figure it out, fix it up, and they stopped going back up. So a hospital, when they came up with DSRIP, and you know DSRIP, you're preventing all these emergency room visits, preventing readmissions, and providing quality service so they don't have to come back. I love that and I believe in that. This hospital, for the partnership that with us for 35 years, had 3 people, I call them the 3 Stooges, Maria Yumtoff, Betty Young, and Sarah Marshall. Everybody in the community know them. This hospital go out into the community because it's all about preventive health. We don't want a healthcare system. Yes, we want, but we don't want a sick care system. And to prevent that, make sure that this hospital represents the community by going into the community, all right?
Thank you. Thank you. Can we have Karen Fleming? Obor Soel? I know I'm saying this wrong. Soleil.
Okay, can you hear me? Yes. I can hear me, okay. I want to thank you all for the work that you're doing. I'm sure that it's extensive. The last time that I was here, I read to the party, everybody who was here, the law that has to do with public officers, which is Article 7, Section 100. I'm not going to read it again. I was given the impression that your moderator, Ms. Holloway was gaslighting my statement. That applies, as far as I can read, to this body. And also, I was not talking about the meetings that we see, that we observe. I was talking about the meetings that we don't know about. To be clear, we know that you are meeting without the observation, without the input of the people that are here. We know this to be so. Also, when we are meeting with you, this is a listening tour. A listening tour is different than an open meeting, where you say what your position is, and we get to counter it. There is no feedback going back and forth here. And so therefore, we only know, well, you're sitting here and nodding your heads, that's all we know. But the process is not transparent. Now, transparency is kind of like being pregnant. You either are or you're not. There is no in-between there. So I'm saying to you that you have a process here that is not transparent, that we know, the people know that it is not transparent, and we're asking you to make that process something which will work for everybody. I have one more thing to say, and that is, we always say that justice is blind. I take the position that justice is blindfolded. We don't know if she can see or not. But it's better in the position that you're in, that you take that in your mind and know that we see, we understand. And, you know, it's up to you how you want to handle what you're doing.
All right. Thank you, Ms. Fleming. If you can please say your name, because I think I may have really not done well with that. If you could say your name in 2 minutes, thank you.
Yes, my name is Soleil Obul.
Thank you.
And we're actually collaborating on a statement, and we're both signed up, so. Yeah.
Hi, I'm Kennedy Austin. I'm a policy analyst in Ancient Song, Inc., a national birth justice organization here in Brooklyn, New York.
And I'm Soleil Obul. I'm also part of Ancient Songs. I organize with them.
So last year, Downstate received $2.7 million to fund the Central Brooklyn Comprehensive Maternal and Child Health Network, an outpatient facility and birthing center in Crown Heights that will ideally provide care to thousands in Central Brooklyn. With an extra $400 million on the table this year, we'd like to see a portion of that money dedicated to a center, to centering Black midwifery model for the center. Funding a birthing center that honors Black midwifery birthing model is a key portion of discussion for reparations. In our communities of Crown Heights and Flatbush, legacies of mistreatment, medical or otherwise, live in our bodies, affecting our ability to heal ourselves. We've long fought for the ability to make decisions for ourselves that promote care, connection, and restoration, and yet our power to do so is undermined by structural and institutional barriers that do not recognize our pain, joy, and process as extraordinary.
Stamped out by the pursuit of white supremacy, patriarchy, and profit, the Black midwifery model revival could have a home at Downstate and pioneering and cultural competent models that honors our Afro-Caribbean and Afro-American birth practices. Doing so would be a homecoming for many Black residents in these areas, especially those whose home countries and families have practiced methods that honor birth and reproduction as a life force that binds the family and community together, and views surgery as a vital medical intervention, but not as the first line of defense. Black midwifery is a model that respects our autonomy, that braids us to our foremothers, as our wombs naturally do by default. As a communal practice, Black midwifery nurtures entire support systems for healthy birthing practices, thus making the way for doulas, partners, and family to provide care throughout the pregnancy, labor, and delivery and postpartum periods. It incorporates traditional forms of healing to soothe in moments of distress, so that so that providers do not have to rely on surgical or pharmaceutical interventions and is not limited to prenatal and postpartum care. Like all midwives, Black midwifery models treat people with uteruses throughout their lives, arming them with the tools to have safe and joyful reproductive experiences their entire lives. Perhaps most importantly, the Black midwifery model empowers legacies in birth through shared decision-making processes between the midwife and the patient. Traditional reproductive care has viewed doctors as shamans, conjuring and hidden knowledge that the body that many women, especially Black women, are actually able to describe for themselves.
Thank you.
We have a collaborated statement, so.
Okay, we're going to give you a couple of more seconds, but we have to wrap it up.
Though we can appreciate the specialization of skill of OBGYN for certain births, we should not shy away from the fact that this should not be our primary source for birth. It is a specialization to be used under certain circumstances, such as high-risk pregnancy and emergency intervention.
So you all have the opportunity to pioneer a culturally congruent model of reproductive care that allows midwives to take the lead on reproductive care and honor the womb as a sacred portal that transfers lineages of knowledge, skill, love, recipes, and keeps generations alive. Thank you.
Thank you.
Thank you. And if you have that in a written testimony, we please welcome you to submit it.
It's online. Is there
Great.
a way for me to upload it?
Yes.
Is there an email that I can send
There
it to?
There is a Q.
On the QR
Yeah,
code,
on that,
you
on
can't
this,
upload it.
No, that's, it'll go to, yes, if you go that site, but if you go, we can also make
Okay.
sure that you get the, when you register, you can also upload the written testimony.
Not on the, yeah, okay.
Okay, but we'll, yeah. Okay. Before we bring up, we have a few of our elected officials with us today. I also want to call up Debbie Eagle. Oh, hi, Debbie. If you can use that microphone, please. Then we have, so then we can send the number, and then we'll have.
Good evening, esteemed panel. My name is Debbie Eagle, and I'm a nurse and an attorney who is working right now for PEF as the Director of Field Services, which covers New York City, the 5 boroughs, and Long Island. I have been here since the current conversation began about the future of SUNY Downstate at the first church meeting. First, I want to thank everyone who is here for their time and commitment, which is all of you, to the future of the healthcare in this community. I stand before you today to present an opportunity, one that aligns our shared mission of strengthening healthcare infrastructure with a vital, impactful solution. There is support by many for the plan put forward by Brooklyn for Downstate, who presented a viable solution. However, there was some concern expressed because the project is projected to cost $250 million more than is currently allocated. As we look at the need for additional capital to rehabilitate SUNY Downstate, we must consider innovative, community-driven approaches to secure the remaining funds. SUNY Downstate, an institution deeply embedded in healthcare and medical education, one such avenue may be leveraging the SUNY Foundation at Downstate, an institution deeply embedded in healthcare and medical education. The foundation has the structure, credibility, and reach to mobilize donors, alumni, corporate partners, and other stakeholders who are invested in the future of medical care. The hospital has already secured $750 million plus through government resources, a major step forward. With the project set to span 3 to 5 years, we have a critical window to raise the remaining capital. If we do not move forward now, there is a real risk that these allocated funds may no longer be available. Delays could jeopardize this once-in-a-generation opportunity to restore and modernize the hospital. By utilizing the SUNY Foundation as a fundraising vehicle, We can tap into a network of philanthropists, grant opportunities that are already aligned with the mission of improving healthcare facilities. We can strategically secure the remaining resources over the course of the project while ensuring that we don't lose the funding we already have.
Thank
This
you.
is more than just, I got 2 more sentences. This is more than just securing funds. It's about building long-term partnerships that will sustain and expand the impact of the hospital's rehabilitation. Investing in this hospital is investing in the well-being of thousands of patients, the education of future medical professionals, and the economic stability of this community.
Thank
With the
you.
panel's approval
Thank
and
you.
foundation, we can take decisive action to continue to raise capital needed to restore and revitalize this essential institution. The time to act is now.
All right, thank you. And if you would like to provide us with a written testimony, we would also share that. Thank you. I would now like to call Assemblymember Farah Souffrant Forrest. You can, if you want, Assembly members, you can come up this way, please. Oh, we had two, and we have Assemblymember Monique Chandler Waterman, who will also speak after.
Okay, thank you.
I got a chair for you.
Okay, so I'm Assemblymember Farah Souffrant Forrest, but I have to call my sister in advocacy, Monique Chandler Waterman, Assemblymember. Go ahead.
Okay.
She's going to give the first part, and then I'm going to give the second part. Go ahead.
Okay. Good evening, everyone. We just drove from Albany to make sure we were here to have this conversation update. I'm New York State Assembly member. Thank you so much, and I do feel better tonight than I did last time. Assemblymember Monique Chandler Waterman, representing Assembly District 58, neighboring right up the block, and I represent East Flatbush, parts of Canarsie, Brownsville, and Crown Heights. So I just want to thank you. I want to make sure I get my thank yous. God, thank the hardworking people here. Thank you to SUNY Downstate Community Advisory Board, amazing hosts with the most, and all the organizers, and of course the heart and soul of SUNY Downstate Hospital, which is all of you here today. I know this is the third public hearing of this advisory board discussing the financial health and sustainability of the future of our future, but the future of University Hospital at Downstate. So I'm proud to stand here before you to applaud your collected efforts of the community voices in the fight to have real investments here at SUNY Downstate, who is still open and is taking care of our community members still, and educating our community as well. So I want to thank you to all the community stakeholders. Thank you, clergy. I see my clergy members here. Sorry, I'm a little bit loud. Can you hear me? Okay. Thank you to the clergy. Thank you to the unions, UUP in the House, PEF, and all the other unions as well, my colleagues, and I in the state, especially Senator Myrie, Assemblymember Cunningham, Farah Souffrant next to me as well, all the heroes from the university to the hospital, and also for the president of this very here institution, Riley, and to Chancellor King as well. So I just want to make sure I get all my thank yous out of the way too. So today we did a thing in Albany, a little thing, right? So we made sure that we propose a budget of what it should look like for our community in New York. So it's $256 billion that we voted on today. And in that massive budget for the state, we ensure we prioritize SUNY Downstate. We made a budget, yes, let's clap that up. We made a budget recommendation to Governor Hochul. We requested in our one house an additional $250 million on top of the $750 million, totaling $1 billion. That was done in the Assembly, that was done in the Senate. So we want to shout out to Cunningham, shout out to Zellner, shout out to all my colleagues, myself, and all of us here today for making sure. Because of your voice, we heard you. The governor has been listening, and through the budget being passed officially, we ain't done yet, we hopefully to ensure that you know that you were heard. So I just want to make sure you remember your voice is vital Do you remember standing outside in that cold? Do you remember where it was just like we couldn't even imagine where we'll be at? But now we're standing here today having hearings, community hearings, to hear your voices, hear your ideas, and also to know that $1 billion was voted on to make sure that we put true investment. When you invest in an institution like this, it's investment into our community members. Don't give up hope. Don't give up hope. Sometimes it seems hopeless because we're looking at the news, we're looking at the politics, we're looking at what's happening at a federal level. Once we have each other, and we know what God has for you, no one can take from you. This is your community. Don't ever be afraid. Be unafraid. Be bold. Knock down these doors. And that's what you did. You braved the cold weather. You came out here collectively. Don't get tired. We still have a road to go. We're not finished. We just got started, but we're moving in the right direction. I'm going to pass it over because I know my time is spent. I'm going to pass it over to my colleague.
So, like I had said in the beginning, my name is Farah Soufran Forrest. Well, I didn't say that. I said my partner in crime. Yeah. But my name is Farah Soufran Forrest, and I am the assembly member for 8057 in Crown Heights, Clinton Hill, Fort Greene, a little bit of Bed-Stuy. Okay? But before I got this very lofty title, I was, am, and always will be a registered nurse. Okay? Now, Assemblymember Chandler Waterman reported back on the numbers. The governor said 750. We said 1 billion. But there is some other things we said as well. With great cash comes great responsibility. The deadline for the task force is supposed to be April 1st. Now, if you wasn't at the first one, I wasn't there. If you wasn't at the second one, I wasn't there. You better had made it by the third one today. That's why you see me here today. But we understand that the stories that need to be told, the history that needs to be said about what Downstate was, what Downstate is, and what we think Downstate ought to be in the future needs to continue to be told. Because again, with great cash comes great responsibility. And as an institution within the SUNY system, the one that I graduated out of, and the community that it's serving, the community that I was born, raised, and the one that I continue to serve, not only as an assembly member, but as a professional registered nurse, there is so much that Downstate needs to continue to do in the community. Now, I have said this behind closed doors. Somebody mentioned behind closed doors. But what I have said behind closed doors to behind closed doors' ears is that as a nurse, when we talk about transformation, the needs at SUNY Downstate are great. There's holes to be patched. Boilers need to be kept. Last time I checked, you're still on Quadramed when everybody else is on Epic. Speak on it. This is why you need a registered nurse to speak on it. So we cannot even begin to talk about AI. We cannot begin to talk about technologies if we don't have the proper software. If we cannot properly bill for everything, then we're missing dollars out the door. So again, when we're talking about transformation, The needs are great. However, the transformation that we had heard in 2024, hopefully with the new task force, they have heard enough. They have heard our pickets. They have heard the rallies. They have heard the voices behind closed doors and outside on the streets that the transformation needs to focus on keeping this community whole. The paper said it. Level 4 NICU, the only one. You need dialysis, this is the only one. I used to work at Kings County. I used to walk pediatric patients over to Downstate because there was orthopedic services that were here that were not over there. And so, within the transformation, I hope that we retain these wonderful, vital services, that we don't cut back, that we take this $1 billion and some more, because I'm telling you, we can get some more. The task force is here, and we're hoping to extend it for June 1st. It was extended. It was extended for June 1st. Sorry, we got that too.
That part.
We're going to keep the conversations rolling, but we hope to also make sure that in addition to the task force, we keep beating the drum. Keep beating the drum that we need to make sure that Downstate stays here today and it stays here forever.
So thank you, Cunningham. And
Thank you so much. Oh, yeah, I got to, but you said it. Thank you. Look. I got to say the thank you. Thank you so much to SUNY. Thank you so much to Chancellor King. Thank you so much to the task force. Thank you so much to PEF, UUP, OMA. Thank you to everybody on the stage.
our representatives.
And our representatives for this,
Cunningham.
Representative Cunningham, and also Senator Zelnor Myrie, all friends and colleagues, okay? Thank you. Okay.
We have an amazing Brooklyn delegation, and we want to thank our assembly members who come with bringing some good news. Thank you so much, and Assembly Member Monique Chandler, I think you've been to 3. We have one more. Well, for right now, we have one more. We have another one coming, but thank you, and as they said, you have been heard. Let's give it up. And, this board has worked very hard to hear from you, to hear from individuals who've wanted to speak on many different venues. So thank you, Assembly members. Okay, we had, did we do Debbie Eagle, right? We did that, now we need Robert Ferrangi? Did I say it correct? Ferrangi. Okay, if you can go to that. Okay, I'm sorry, but please repeat your name again when before you speak. Shella Kamarajan. Okay. And Lisa Dressner, Dr. Lisa Dressner, and I'm sorry, Dr. Kamarajan Shella. Did I say that correctly? You'll say it again, thank you.
Hi, I'm Dr. Robert Ferrangi, Chief of Pulmonary and Critical Care, and a person who grew up in this very neighborhood. Thank you for hearing us out. I appreciate the efforts of the board. One thing I wanted to do is dispel a narrative, because I heard that, 70% of our admissions are through the ER, and that's bad, and then 70% of our payers are government. Well, if that's the case, Mount Sinai and Columbia are about 70% government payers as well. The difference is those institutions get compensated for the same service at a higher rate. So I want to bring that up to dispel the narrative that this is a poorly run, bad hospital. This is a good hospital that provides excellent care to the community. What should we have for the future? Well, the chairs have put together a vision. I agree with it, improving maternal services and fetal services, improving the ER footprint, transplant, building up cardiovascular services. People should be getting TAVRs here. This is how modern valvular disease is treated, and it's not being done in central Brooklyn. People should have cardiac surgery access right here in their community. I don't want, if I'm infarcting, to be taking some ambulance to Manhattan while my anterior wall dies. It should be right here. And we need oncology services. Now, a key part of doing this, I heard outpatient, inpatient, we need both. One of the things that's going to feed these services and justify their existence here is to have a large outpatient center where we can get the people that need these services connected with the doctors and the nurses that provide them. And we need a large ambulatory service. We don't need 2 general medicine doctors in clinic. We need a team. And there's lots of ways you could do that. Perhaps getting people, physicians from the community to be part of this ambulatory center. And another thing that I brought up at our last meeting, we have to increase access. Part of increasing access is making it easy to come to the medical center. And that means having a parking lot for the staff and for the patients. My patients have COPD, they're walking 4 blocks to see me. And there's no shortage of patients that want to take advantage of the outpatient and inpatient services here because they know they're excellent. Thank you.
Thank you. Thank you. Thank you.
Hello. Esteemed Advisory Board, after submitting 2 written testimonies, I decided this time I will speak. And I'm a faculty member as well as a member of the executive committees of the SUNY Downstate and the College of Medicine. I'm also serving as a scientist in a world-renowned laboratory that is housed in the same hospital building. This laboratory has been involved in cutting-edge research on addiction, neuroscience, and genetics by receiving continuous NIH funding over the last 50 years. As I mentioned in my previous written testimony, it is now the time for sharing important and useful ideas to modernize and revitalize the SUNY Downstate Hospital, which is considered the lifeline for the community of Central Brooklyn and beyond. I would also suggest to the advisory board to extend the modernization plan to cover the entire university system of the SUNY Downstate, which is a pride of this nation and the world, as numerous clinical innovations and groundbreaking scientific discoveries happened in the very same institution, as summarized in the book, Downstate at 150, a celebration of achievement. This book covers 150 achievements and discoveries by luminaries, and I, in fact, gave 1 copy of that book to our chancellor in the first meeting in the church. Let me start my testimony by reiterating that I do stand in solidarity with the staff and faculty of SUNY Downstate, as well as the people of Central Brooklyn, in calling on the Downstate Community Advisory Board to help maintain the operation of the SUNY Downstate Hospital as a freestanding, state-operated SUNY hospital at its current location, so that it will thrive not only to serve the Brooklyn community, but also to produce and nurture talented physicians as well as biomedical scientists for the generations to come. With regard to the restructuring plan, as I stated in my previous testimony, I strongly urge the board to follow the plans and priorities outlined in the letter drafted by the chairs of all clinical departments of SUNY Downstate. While I had listened to major aspects, While I had listed major aspects of the chair's original letter in my previous testimony, I was recently informed that the chairs of the clinical departments have updated their proposed plan and drafted a new letter as of February 26, 2025. The new letter also I have attached in my written testimony, which I have uploaded. But they have outlined 3 major points, but I don't have time. Please go through the written testimony. Thank you very much for
And
the
if you can please, we would love to have with your written testimony so that anything that we've missed.
All that.
Okay, thank you. Dr. Dresser,
Hi,
2
my
minutes,
name-
please.
You can hear me? Hi, my name is Lisa Dresner. I'm a clinical surgeon, but I'm also the designated institutional official for SUNY Downstate. That means that I'm responsible for the accreditation and of the programs that supervise 980 residents, that's doctors in training, across 55 programs that are accredited through SUNY Downstate. Anything that would jeopardize or substantially diminish the inpatient and outpatient services at Downstate would disrupt both the education and training in these 1,000 or so residents and 55 programs, but also impact the financial stream that pays for them. Those 1,000 residents or so, their work effort is paid for by CMS. Half of their work, about 400 of them, are paid through the UHD CMS license, and anything that diminishes the inpatient and outpatient services would diminish that enterprise. These residents come, work in our borough, live in our community, and provide health care to our patients. They come to Downstate to take care of patients and learn at Downstate. Our own evaluations have shown that while many of the residents spend some of their time at other hospitals and see many patients, for example, at Kings County, the core of their academic training and education is with the faculty and in the hospital at Downstate. I really want to emphasize the importance of their training programs to this community, to our academic goal. The residents do need to go to other hospitals because of the de-investment that's happened at University Hospital Downstate. Cardiac surgery, ECMO, cardiac MRI, and all sorts of those kinds of services don't happen on this campus. So we have to send them to places far and wide. I want to thank you for this opportunity to be heard. Thank you.
Thank you. Thank you. We have Dr. Newware, Henry Rodriguez, Ann Harris, and Hazel Williams. If you could please line up by the microphone, and 2 minutes, please.
Okay. Good evening, everyone. All right, members of the advisory board, I'm thankful for this opportunity to share my thoughts on what I believe will make a stronger Downstate. My name is Effie Conan Newware, and I have the privilege of leading the occupational therapy educational programs here at the university. I'm here today to share a vision of the medical center as a premier destination for rehabilitation care, education, and research. It's known that the medical center does more than provide vital health care services to the Brooklyn community. The medical center is a cornerstone for education, clinical training, and research that shapes the future of healthcare in Brooklyn and beyond. Downstate has long been a training ground for some of the most talented and dedicated healthcare professionals in our state. From the medical school to our schools for nursing, the allied health professions, public health, our students learn here, they serve here, and they should be able to build their careers here. We must invest in the physical and capital aspects of the medical center, not only to provide exceptional care, but also to attract the next generation of clinicians, researchers, and educators who will advance our mission. I admit, I'm someone who passed Downstate to take the 5 train into the city. I hopped on the Belt Parkway to go points east, but I'm here now, and I'm all in. Part of what I hope is that the patients, students, clinicians will no longer have to take the train or drive past Downstate to seek opportunities to learn and for better health. With revitalized facilities and expanded health services, we can ensure that the future occupational therapists and other healthcare providers have hands-on training they need to serve the community with excellence. This is an opportunity to modernize, innovate, and reaffirm Downstate's role as a premier academic medical center, one that draws talent in instead of watching it leave. Rehabilitation services are already a strength of this institution, contributing to the financial sustainability of the hospital and the well-being of our community. The Department of Health designated stroke program demonstrates a caliber of care that we can provide, but we can also do so much more. With investment in a modernized ambulatory rehab center and state-of-the-art inpatient facilities, Downstate can become a leader in treating complex neurological, orthopedic, cardiopulmonary conditions right here in Brooklyn.
Thank you.
Imagine a rehab center with a single capacity room offering patients with privacy, dignity, and comfort as they recover. Picture a facility equipped with overhead patient lifts and advanced technologies that allow us to serve individuals with traumatic brain injury, spinal cord injury, respiratory failure, these conditions that right now people are seeking elsewhere. So it's not just about keeping pace with other institutions, it's about setting a new standard.
Thank you.
I'll say for my occupational therapy students, this means an unparalleled hands-on training for interdisciplinary practice. And it means a place to learn where innovation drives patient care.
Okay,
So
we really
thank
have,
you so much
thank you.
for your
Thank
time.
you. And please, if you haven't.
I will submit my testimony online. Thank you.
Thank you, thank you. And there's so much great information that people are trying to provide, and I know it can get frustrating with the 2-minute, with the 2-minute window, but we are trying to get it to as many people as possible this evening. So we're just asking, and if you have it written, we do, the board members do read every testimony. We make sure that they receive it. So please, if you've written it out, submit it to us. If you don't do the full 2 minutes, it will be read. Thank you. I just want to make sure, because we have a few people that I called, I just want to make sure if you're available, Henry Rodriguez, Ann Harris, Hazel Williams. Okay, if you can please.
I'm sorry, I had to run back and get my other piece of paper. Good evening, members of the Downstate Community Advisory Board. I am Hazel Williams, Vice President of the Professionals for UUP. And standing next to me is my daughter, Janice, and my granddaughter, Jayla, both whom are benefactors of the SUNY Downstate Healthcare. For I am grateful. Revitalizing acute care are essential for patients' emotional, physical well-being. It also embraces the very fiber of health disparity, chronic conditions, while meeting the needs of the underserved by ensuring a healthier Brooklyn. This can only be accomplished with the acquisition of state-of-the-art healthcare equipment. Quickly journey with me through the emergency room, where I see a look of an observation unit for people to be observed and very levels of trauma settings for adult and pediatrics, state of the art. We need updated ICU units, places for families to assist their patients when making life-changing decisions. We need places for our families, but Brooklyn has the highest number of pregnancy-related deaths among all New York City boroughs, with the highest rates in Central and East Brooklyn, particularly impacting Brooklyn immigrant women. Maternal health crisis exists, spark racial disparities, and many deaths are considered preventable. Downstate needs to be the lead major prevention grounds, and we can state-of-the-art resource. I touch on a few services. 2 minutes wouldn't allow me to do more. The community future for the quality of healthcare is at hand. Your jury, when the deliberation begins on how the funds should be used, remember the faces of the community. In the need of a great hospital and its wealth of services. I leave you with Proverbs 2:11. Wise choices will watch over you. Understanding will keep you. please watch over us. SUNY Downstate.
Thank you, Ms. Williams. Thank you. So that completes the number for those who registered to speak. We are now going to hear from those who've registered tonight. If you are interested in signing up tonight to speak, we are still taking a few people. So we will start. And Ms. Williams, you were on this list too, so thank you. Matt Chaco? Brianna Watson? Thank you. Ivani Tabjon? Okay. Randall Banbor? Sarah Marshall? And Lovita McIntosh. Thank you. If you please.
Okay, great. Good evening, distinguished members of the board, and a very heartfelt hello to the community that's in here with me. My name is Brianna Watson. I'm the Deputy Executive Director of the Health and Education Alternatives for Teens program. We're known as HEAT. We're a small but mighty outpatient clinic here at Downstate. I'm also a doctoral student, and I'm the council president at the School of Public Health. I'm also an active qualitative analyst and researcher focused on maternal health here in Brooklyn. So that means that every aspect of my work and so many pieces of my passion is rooted here at Downstate. This institution is central to healthcare in our borough. We provide life-saving services to individuals who would otherwise be left without care. Its future must be secured through thoughtful reinvestment that prioritizes the people who rely on it most. At HEAT, we care for young people living with or at risk for HIV, many of whom experience housing instability, underemployment, and stigma. They turn to Downstate for PrEP, HIV treatment, and case management services that allow them to stay engaged in care. Transgender and non-binary young people, who I haven't heard mentioned yet, in Brooklyn depend on Downstate for gender-affirming healthcare. Through HEAT, they receive hormone therapy, medical services, counseling. All of this is done in a safe and affirming environment. These services are not widely available elsewhere in the borough. My research focuses on maternal health care access for Black women in Brooklyn, a group that I don't have to tell you all already faces disproportionately high rates of death and inaccess to postnatal care. Downstate also serves as a training institution for future doctors, nurses, and folks like me who are public health professionals. Many students who complete their education here remain in Brooklyn to serve their communities and know how to serve their communities. The fight to keep Downstate open was a fight for health equity in Brooklyn. Now, as discussions turn to reinvestment, decisions must be made with the well-being of patients, students, and providers in mind. Reinvestment must put people first, not politics, not bureaucracy. Decisions should be guided by the needs of those who rely on Downstate every day, not the red tape, not the political maneuvering. Please prioritize transparency, care for marginalized youth, maternal health care, and health equity initiatives above all.
Thank you. Thank you.
To God be the glory. I like to, good evening, everyone. And I'd like to thank for this opportunity, and I'm going to be respectful of the time.
Thank you.
I'd like to thank Reverend Williams for shouting out to myself and Betty Jones, who are still here. If I started to tell you the different titles and the things that I do, it would take all night, so therefore I'm not going to begin. I am considered Dr. Sarah Marshall, and I am patient advocate, healthcare advocate, and also I believe in collaboration. I've heard from my colleagues about the nurses, about the physician. I believe in we all working together because we are a team. And doing so, we will then provide the services that is needed for all. And yes, we do have structural requirement that we need, and those are the things that I'm sure that we can accomplish if we then work together. So we want to look at how we can achieve those things. Another thing is that we want to look at the system biases. I've heard someone mention that we need more of this, more numbers. What I advocate is that we want to have effective utilization of the resources that we have. And therefore, if you need help, myself and Betty Jung, who's still here, we will assist you with that, because we go out into the community where the patients are, and we've saved lives. And yes, it is a plus to SUNY Downstate for us to be here. And I have been an employee for SUNY Downstate I just made my 50 years. And I have not wavered in my motivation to continue to work here. And anyone that know me or that know my work that I've done and my work that I'm doing speak for me. Thank you.
Thank you. Nichols, and I'm a member of the 2.7 million people who call Brooklyn home. As a member of Downstate and an engaged community member, I stand here today to voice the urgent concern for the people that I interact with in the community. This is the third hearing with a 9-member panel, and we're still waiting on crucial feedback. Where are the deliverables? Where's the summary of all the meetings? They're not available to the public. This is starting to feel like January 2024 when we were outside the church. We urgently request a list of the consultants, our urban planners, architects, or builders from Central Brooklyn involved in this process. We need to know. What can we expect from this 90-day extension? It's not time for stonewalling. We need immediate answers because our community health is on the line. No more extension after June 1st. We need a plan, as our community health hinges on the panel's recommendation to the governor. We have heard nothing about the preliminary discussions or action plans. We saw that. That's very general. I could have did that. It's alarming that some of the panel members don't take notes. I've seen people laughing at the hearing. What are we laughing about? This is our community, and this issue is very serious. We're not talking about finances. These decisions directly impact lives of the people in this community and determine health outcome. Poor choices have dire consequences. Healthcare in Central Brooklyn is not abstract. It's a daily reality. Many of you may never utilize these services. However, your role is crucial in prioritizing community health and the well-being in every decision. We demand transparency, accountability, responsiveness to our concerns. We hold you accountable for every choice that you make on this panel. We have witnessed our community collective vision. Brooklyn for Downstate submitted a plan. We've heard nothing back. But as Congresswoman Clark said, we have the potential to be the Mayo Clinic in Central Brooklyn. We will reclaim our leadership in healthcare, but this requires a genuine investment from New York State in our community. Let's work together to build a healthier, fuller Downstate for all of us, with transparency, accountability, and responsiveness we demand. I also want to urge you that in the One House bill, both of them put in for $250 million. I don't want to see a plan anymore for $750 million. We are going to get $1 billion. I need to see a plan that's responsive for that. I need to know who are those consultants, where did they get the figures from, and I'm tired of hearing that we're using consultants that actually did the plan to close us. Let's get rid of them and get some people that believe in what Downstate can be. Thank you.
Thank you. Thank you. Also want to once again remind everyone that if you have a written statement, if you can please put those written statements, send those written statements to us. Also, the slide deck that you saw, and we do recognize that some of you received, that we showed it today, that did offer some information. You can find the slide deck is on the public website, that you can actually do the QR code right now, and that information, some of that information is there. The recordings of all of the public hearings are also available online. So we are working hard we hear you, we are and we just want you to know where, for right now, some of the information is available. I'm sorry, your name is?
Dr. Maureen Beverly.
Okay. And I want to call Carl Henry Caesar. Is that you? Oh, okay. Okay, thank you. Okay, please, 2 minutes, please.
Hi, good evening. Sorry. Hi, good evening, everyone. I think we're at a pivotal moment, and we have to think about.
A little bit louder on the mic, please.
I think we're at a pivotal moment at this point, and we have to think about where do we want to be. If anybody in this audience or on the committee here knows of any hospital across the nation, north, south, east, and west, rural, urban, that the black population has the better health outcomes, please let me know. I've researched it, and there is none. I don't care whether it's maternal health, sickle cell, any disease, and the elderly black population has the worst health outcome in all disease category. So Downstate has an opportunity to be the model for the nation. Not only do they have a hospital, but they have nursing school, they have medical school, public health. With all these resources, why can't we be the model? If you look at the leapfrog score at Downstate, it's in the D's most of the time, okay? And when the patients come in, so the patient engagement and value is key. Because if you don't value me as a human being, my health is gonna go south. And I think there's the human value that is missing because it's a black population. And I had a friend who came here, and I just given that, she's in Brooklyn, she's born in Brooklyn. She's a retired school principal. Her and her husband, her son got taken to the emergency room. He had a seizure, so the mom went with her in the ambulance, and the dad went drive. And so when they had to do the intake, guess what the question was? And I blew my mind. So who are you? And she gave him the name, and you are his mom. And who are you? Gave his name, and I'm his dad. Guess what the question was? So he has two parents? That's the level. And he said, you know what he said? I should have told her I just got out of jail. And there are two retired school principals. So the value of the human patients and cultural competence comes in because it has to be American-born physicians to American-born patients, but also foreign-born physicians to American-born patients, and American-born physicians to American-born patients who are different than themselves. And we have an opportunity to improve the health. The last thing I'm gonna say, the focus on the elderly black population who has the worst health outcome in all disease category when you consider all the atrocity that they went through. And the last thing I'm gonna say, when a Holocaust survivor comes into Downstate or any hospital, we roll out the red carpet. Chief medical officer, the board of director, the CEO, the rabbi will go and see that patient, and so they should because of the horrific circumstances that they endured. But when an elderly black person who fled the South because of Ku Klux Klan, lynching, and Jim Crow, how come we don't roll out the red carpet? And it's an opportunity to recognize all atrocity survivors the same, and to recognize the role of religion in these two populations who are pivotal to their survival.
Thank you. Thank you. Appreciate you. Thank you.
Good evening, folks. I'm Thomas Sanford. I'm one of the medical students here at Downstate. Before I start, I want to thank all the faculty from Downstate that came, especially Dr. Marquez, sitting just to my left, who's finding out now for the first time that he is my favorite professor in this entire school. I want to tell you about a patient that I took care of this week. This man was a victim of violence in our community. Blood was filling up in the space around his lung, and the time left on his life without help was measured in minutes, not hours, and not days. Through heroic efforts by emergency residents here at Downstate, efforts were made, surgical interventions, within minutes of him getting into the door to save his life. He was then transferred over to Kings County for the rest of his care, as that's a trauma center. He spent the next 4 days sitting in their emergency department because they did not have a single bed, not one bed, that they could put this patient, get him out of the ED in a place where they could give him the care that he needs. There is no space in this community for one fewer inpatient bed than exists right now. So my ask for you is simple. take the money that we've been given and invest it into the building that already exists. The walls are not falling down. Water flows through the pipes, and after the last capital investment, it's potable now because we finally started chlorinating it. Make this hospital a hospital that has the services that we need and that the community needs.
Thank you. Thank you.
Folks, good evening. So I am Carl Henry Cesar, the chairperson of Brooklyn Community Board 14. And so I want to thank you, the CAB members, for being here, and everyone else who's been here in the prior public hearings as well. So I'm going to be very brief. The first thing is I echo what Chairperson Baptiste said. I echo what this woman herself said and many others regarding transparency. You are doing work. The financial figures was a start, but it's still 2 public hearings too late. And so it's a start, but there's more that needs to be done, and so I thank you for that, but please know there's more that needs to be done on that. The second piece is, in the spirit of process, because the deadline is now June 1st, I am asking for a public hearing in April, I'm asking for a public hearing in May, and I'm asking that the last 2 weeks of May, you have public working sessions where the whole community comes together and looks at the report to then finalize that, because right now it is a one-way dialogue. You would get more buy-in by having the last 2 weeks have public sessions where we work with you to look at the report and the recommendations that will be sent to the governor. Everyone won't agree, but people would have more respect for the process instead of feeling that people are just listening and then an email gets sent on June 1st and that's the end of it. And then the last piece is another process thing. The financial figures was a start. You saw that people were starting to critique the numbers and the figures. That's why this transparency is important. So I'm asking again that for the 4th meeting in April that's yet to be scheduled and the 5th meeting in May that's yet to be scheduled, you dig deeper, you dig deeper into those numbers where you start showing, okay, what would it look like for $750 million all in inpatient, like the surgeon just said, versus $1 billion. So bring that information here. The people here are smart. They know what they're doing. Increase that transparency so that you can have more robust feedback to make the final report even better. So thank you very much for your time.
Thank you. Thank you. This is it? Okay. So this concludes our testimonies for, oh, no, I'm sorry. Mr. Baptiste, you're going to read a statement from Assemblymember Brian Cunningham? What, did you register, what's your name? I'm sorry, if you would like to speak, it's fine because I don't have you, and my apologies, I don't see you on the list, but that's fine if you would like to speak. And Mr. Baptiste, it's fine that you be the last speaker. I know that Assemblymember Cunningham usually waits till like the end.
Good evening, everyone. Thank
Good
you,
evening.
board,
Do you
for
want to
coming
pull
to
that down closer to you, sir?
Coming to
Thank you.
SUNY Downstate. My name is Yvette Gardner. I am here 30 years. I am maintenance. I am a painter here. I have noticed that everybody has spoken about the staff, the medical conditions, the medical situation. I need to speak about the structural. I am FMND. I represent some of my colleagues. We are the plumbing, the painting, the carpentry, everything that's going on in the building. We are in an old setting, an old structure. Yes, there needs to be maintenance. We need more funding for the maintenance, and we need accountability for the contractors that you are bringing into the building. Because you are bringing in contractors that are charging exuberant amounts of money, and they're not efficient. We have negative airflow, we have positive airflow. They are not connecting in those areas. We do not have pipelines that are running. We have had air ducts that have been removed There is no airflow coming in. You hire these people to do fire stops, but they're not here. You hire these people to do electrical wiring, and they're not doing everything properly. There is no accountability. The project managers are not walking around and maintaining. In the 30 years that I have been here, I have seen contractors run water and electrical in the same area. That is hazardous. That is not safe. Another thing is when you are removing the air ducts, where is the negative and the positive air going? When you are breaking down the structures in the wall, do you go all the way down to the brown coat? Are you having rusted wires? When you're not pointing the building because nobody's checking you, we have water structure that is coming through the bricks. Okay, you're laying tiles, but they're not lined up correctly. So the thing about it, you're putting up sheetrock walls, but there's no installation. So my thing is, if you're charging us $70 million, and these contractors are at prevailing wage, some of them are $62 an hour up to $195. The inside maintenance workers, the lowest is $17 an hour, the highest is $23. Okay? Our cleaners, because you contract the cleaners from the outside, you're paying them top dollars. Our cleaners are grade 5s, 6s, 7s, 8, 9s, 11s, and 12s. Our engineers are 14 and 16s. Our starting salaries are $29,000, okay? That's the lowest. I am a grade 12. My salary is $59,000. I've been here 30 years. When I came in this building, I was a grade 9, $24,599. So let me explain something to you all. Our salaries do not match our cost of living. Some of us are at $17,000 rents, but we're taking home less than $700 every 2 weeks. Okay, we have to work overtime. If we don't work overtime, we don't have a place to live. That does not include the fact that if we have to decide between eating, car fare, our medications that most of us require, or else our bare necessities. So my thing is this, you allocated $750 million plus another $250 million. The structure is an old building. We need to maintain it. The staff here is exceptional. They do extraordinary work. They have saved my granddaughter, my sons, my daughter, and my family members. We need SUNY Downstate. We need this structure to be sound, and we need everybody to be safe in this building. We need to eliminate the contractors. They're charging too much for the work that we're doing better. Because we still have to go behind them.
Thank you. Thank you so much. Thank you so much, and you know, you speak to the many challenges that the DCAB is facing, the challenges all of us are facing on where to allocate the funding. The funding that was allocated, the funding that will come, is part of the challenge. But thank you so much for your statement. I don't want to miss anyone, because I would have hated if we did not have your statement. Is there anyone that signed and did not have an opportunity to speak before we conclude this evening? I want to thank all of you. I know some of you, this is the third public hearing, and I'm sure you will make sure that you will attend all of them. Which one? I'm sorry? Mr. Baptiste, I wish you would just correct me when I do that. It is not, you know, I do the best I can. I'm so sorry, because I do want to make sure that that Assemblymember Cunningham's statement is read, and he usually does this at the. See, somebody beat you to it. Okay. All right. You're going to be the last one, 2 minutes, correct?
Yes.
Yes. Thank you.
Less
And
than 2
then.
minutes.
just get up, Mr. Baptiste, and close us out? Okay? So that I don't feel bad if I just keep, I don't want to keep talking. So, okay, sir, if you could give us your name.
Okay, my
and
name is
2
Frank
minutes.
Reese. I work the grounds here. We do the cleaning, the outside, and everything else. My point is, I do have a history with Downstate. My last 2 children were born here. They took care of my mom, and I worked EMS. I know what the doctors are like here. I worked EMS for many years, and this was one of the places that I served. They do extraordinary work, but the thing is, I believe in divine intervention. The Lord sent me here because I'm doing something that I never thought I would do, because God has given me many other skills. But the divine intervention that I see by coming here, there's someone that the Lord sent here that knows how to put this place together. Northwell started with 1 hospital and now has 23. And this person that's here started with them with the 1 hospital and helped build it to 23. He knows how to put the whole structure together. He doesn't want me to call his name, but if you want to listen, he said, get rid of the politics and he'll show you how to build it. He doesn't want the money or anything. He just wants to see Downstate grow. As they say, with milk, the cream rises to the top, which is the best, and Downstate should be that cream.
Thank you. Thank you.
It's me again. Okay, thank you for this opportunity to give these remarks on behalf of Assemblymember Cunningham. Unfortunately, he's picked up a bug and is feeling under the weather, but he remains fully engaged in this critical issue and deeply appreciates the opportunity to share these remarks. We want to begin by thanking Governor Hochul for doing the right thing by extending the deadline to July 1st. This extension is not just a procedural move, it is a recognition of the hard work, advocacy, and dedication of so many who have fought to ensure that SUNY Downstate has the time and resources necessary to transition in a way that prioritizes both its workers and the communities it serves. We also want to express our deep appreciation for our colleagues in the Senate and Assembly, as well as the countless healthcare professionals, union members, and community advocates who have been relentless in their advocacy. This extension was not given. It was fought for, and we thank each and every person who stood up to make it happen. But let me be clear, we are not here to fight for Downstate. That fight ended a long time ago. Instead, we are fighting for the future, for the world-class institution that Downstate must become for the generations to come. It's not just about preserving a hospital or a medical school. It is about reimagining and rebuilding an institution that can be a national leader in education, healthcare innovation, and patient care, especially for historically underserved communities. As part of that effort, we are securing over $1 billion in the Assembly's One House budget to support this transformation. But this is just the beginning. We are committed to ensuring that new funding is secured not just this year, but in every budget moving forward. This is not a one-time investment. It is the foundation for a long-term sustainability, growth, and excellence at SUNY Downstate. The path forward will require transparency, accountability, and a commitment to ensuring that the workers, students, and patients who rely on SUNY Downstate are not left behind in the process. We must not allow this transition to be driven solely by financial considerations. It must be guided by a vision for what this institution can and must be. Assemblymember Cunningham remains committed to ensuring that SUNY Downstate's transformation reflects the needs of our communities and the values of equity and excellence in healthcare. We look forward to continuing to work with all stakeholders to make this vision a reality. On behalf of Assemblymember Cunningham.
Thank you. Thank you, Mr. Baptiste. Thank you, Assemblymember Brian Cunningham. We want to thank all of you and community stakeholders who we hear you. We thank you for your advocacy. We thank you for sharing your vision. We thank you for holding, everyone to the fire.